I'm Dr. Adam Fields. I'm a chiropractor. Let's stretch the pain out of your neck. Grab the stretch out strap, or I prefer the Pettibon 6-way neck stretch strap. And let's put right here, let's get the buckle right above your eyebrow. And then we're gonna wrap this strap around the outer part of your leg. And then you're crouching down a little bit and then just lift your body. Okay, and what we're gonna feel here is we're gonna feel the suboccipitals as you tuck your chin down into your cervical spine and then all the way into your mid-back. It's just incredible. You know, I do posture correction and cervical curve correction in my office, and sometimes we just hit a wall. Maybe somebody has arthritis, maybe their facet joints are arthritic, and then we get out the stretching strap, and boy, we start to get results. It's incredible. So really, you can literally stretch out some adhesions, really stick your belly out, keep that chest up, and allow that to just go. Now I want you to change by just turning your head a little bit further towards your armpit, and then lift again, and we're gonna target a little more the levator scapula muscle, which attaches all the way up to the atlas. It's amazing. So that just lifting your scapula can influence that top bone in the vertebral column. All right, let's go ahead. Now we're gonna have the buckle right over your ear. Loving it. Okay. And then we're gonna send that strap to the outer part of your arm. Okay, and then around the outer part of your leg, and then hunch down a little bit, pull that strap, and then just lift up. Okay, you're gonna feel this. This is gonna be nice as far as the scalene muscles go, and pull that scapula down. Pull it down on the opposite side so that you just feel almost a tug of war between your shoulder and your head. And you're just lifting that posture, which is going to pull that head further down. This is a good one. Boy, if you've been plateaued as far as neck pain goes, this is gonna take you to the next level. If you're experiencing soreness, just let up a little bit. Binding pain, let up a lot. Sometimes you can just kind of bring the head back a little bit or forward a little bit and find the area that feels okay. It might be like threading a needle, but you'll find a place where that stretch needs to happen. Okay, we're gonna go around the back. So go ahead and move the strap around the back, and let's go ahead and turn your head as far as you can to the right. Good. And now hunch down, take up the slack, and lift and feel that stretch right in the front here. Again, you might feel a binding in your trapezius back there. If you do, again, bring it back a little bit, bring it forward a little bit, and find that area that works for you. Even pull the scapula back on the strap side and let it pull a little bit differently. This is great for lymphatics in the front. Also, you know, a lot of times the lymphatics aren't moving enough, and this is where a lot of infections happen. Let's get some fluid flow dynamics in the front part of your neck. That's a good stretch. I'll check people, have them bring their head back and look up at the sky and see how many degrees their neck can go back. And then we do this particular stretch, and boy, invariably you see, oh wow, you have more range of motion. This is incredible. So we try and get somebody to be able to extend back at least about 75 degrees when we're doing neck rehabilitation. Okay, let's go ahead and just uncoil that, and we're gonna go over to the other side. Okay, so the buckle again on that eyebrow. Actually, let's go like this. And then we're gonna bring it around your leg. It's okay if this thing comes down a little bit as long as it's not hurting your eye. And now we're here, and now we're gonna bring that chest up, and you're gonna feel that chin come down. The chin with your mouth closed really should be able to go to your rib, really. And just lift and feel that beautiful stretch in that upper mid back. This is just nice. And those facet joints, the joints in the back of the spine are opening up and hopefully drawing in fluid and getting some hydration. If this causes tingling or numbness or arm pain or anything like that, stop it immediately. Have yourself checked. You want to make sure you don't have a disc injury, herniated disc, or even a bulging disc. And just let that stretch out. Feeling that upper cervical right where your skull and your neck meet, feeling that stretch out, pulling that. Now just rotate your head a little bit towards your armpit and do the same. A little more of that levator scapula. Feeling good, taking care of you. It's a great day. You are doing exactly what you need to be doing right now. A cervical spine that's more flexible has been shown, really, the proper mechanics, even to help cognition. So let's go ahead and get the buckle right over the ear and to the outside, your outer deltoid. Wrap that strap around your leg and pull it. And let's hunch forward a little bit so you can get some slack out and then lift up. And here you are. Oh, just loving it. Just feeling these scalene muscles and and even the joints in your spine opening up. I'll often put people in this position and then do laser on the class 4 laser on this part of the neck, and you just know you're getting it right into the joints on the outside there. It's wonderful. Good. So yes, a cervical spine that's mobile and that has good mechanics is helping cognition. It helps your what's called sympathetic tone. It helps you bring down the sympathetic nervous system, that fight or flight, down into the parasympathetics. It's amazing. Just the more we study cervical spine mechanics, the more we see that it just bleeds into brain function and all kinds of, even sleep, and rewarding yourself when you do something good, and dendrite activity in the brain. It's quite phenomenal. So let's go ahead and let's do the last one. And we're going to bring the strap back behind, and you're going to turn your head as far as you can towards that side and lift. Just let me get a little more. There you go. So you're lifting, you're feeling the sternocleidomastoid here, you're feeling the platysma muscle. There's all kinds of deep cervical neck flexors in here you might even get to, and you're just letting it come back. Sometimes the occipitals are so tight and locked down, and this can take that further into that some people might have a little dizziness here. If that's the case, just pull out and then do that 45-degree stretch again. That's really the one you want to start with. You don't want to start with this one. You want to pull it forward and then come back. Oh, it feels intense. There might be a little soreness, but this is so worth it. Good, and just lifting. Okay, let's go ahead and just turn your head left and right. Ooh, there's a little lightness there, huh? And just turn your head, get any kinks out, left and right. You can follow this one now that the muscles are more relaxed. Then I have people do the Pettibon traction at home and then actually lay on a fulcrum to start remodeling the spine. Good, and let's do some nods. Good, and pull the front of the neck muscles down, just like that. Good. I have a lot of cervical spine videos. Keep checking them out and doing them. Use that prolordotic neck exerciser and be the captain of the ship of your neck.